Hi there, I'm Dr. Ed Trom at 3D Integrated Wellness, and this is a wellness moment. A couple of minutes for you and me to just talk about some interesting stuff in healthcare. Today I'm going to just talk about a mini case study. Part of chiropractic is it's quite an amazing practice with just using our hands, understanding the human body, the way muscles work, the way fascia is arranged, the way fascia becomes pathological, and and how that affects biomechanics and how that can affect joint health, or how that can make us have muscle and joint pain, how that can affect neurology, and how that can affect the function of our organ systems. It's quite amazing. But today I'm going to talk about something simple. A patient came in with what's called a lateral epicondylitis. That's pain in the elbow on the outside here. Or you can have a medial epicondylitis on the inside, both of which can be very, very challenging to fix because they can be very nebulous. We don't know where it comes from. Unless there's a trauma to that part of the body, we don't really know what's causing this. But it's definitely coming from some kind of a distortion of tension along the lines of force for anywhere from the hand to the shoulder to the opposite side of the body. In this particular case, this gentleman had lateral epicondylitis for months, 9 or 10 months. And he had physical therapy and stretched it. He had injections for it. None of this really worked. And what that tells us is that our typical training as physicians is to focus on the chief complaint or the site of pain. If somebody says, my elbow hurts here, we're trained to examine that elbow and treat the elbow. As you go on in practice, as you study and gain experience, you start to learn that a lot of issues come from other parts of the body. In this particular patient's case, it was from the wrist. There was all kinds of density in the fascia of the retinacula that wrapped the wrist. And he also had a lot of pain and dense tissue right here in the middle of his forearm. And by working those parts of the body, along with some upper shoulder area, we resolved this shoulder pain in about 3 treatments. He had gone for months, remember, with significant pain, an inability to work and to shake hands without pain, couldn't carry a bucket of water. It was just far too painful. Months. And we treated him in 3 treatments just by thinking through things, by understanding the lines of tension through the body, through the fascial system. It's an interesting case, and it's something we need to think about. It's a good reminder of how complex biomechanics are, muscle force transmission, and the fascial system. It's a good example of how complicated these things are, and I'm just happy that with experience and training and practice and study, we were able to help this gentleman get his elbow back. We'll see you the next time.